About 2.5 million students graduate from high school every year in America.
But only 71% of those students enroll in a post-secondary institution.
And on top of that, more than 1 million high school students drop out of school every year.
The lack of knowledge among high school students is the main contributor to this problem.
Healthcare is a field with vast opportunities that continue to grow.
Here's a film to educate high school students about the different healthcare careers.
I am the project manager of the Meharry Consortium Geriatric Education Center. My job is to manage the federal grant that funds a geriatric education consortium, which is basically a collaboration between Meharry, TSU, and Vanderbilt University to train health professional students and faculty and professionals who are already out in the community in geriatric care.
My job title is clinical psychologist and assistant professor. As a clinical psychologist, I'm a health professional who works with medical patients here at Meharry who may be struggling with some issues related to their health.
I'm the associate professor in the Department of Family and Community Medicine, and I'm also the director of medical education in the Office of Student and Academic Affairs here at Meharry Medical College. Twofold. I'm what you would consider a clinician educator. So I have 50% clinical duties in which I take care of patients in a clinical setting, and that's the inpatient, which is the hospital, the outpatient in the clinic. And I also take care of patients at a nursing home out in Murfreesboro, Tennessee.
A tough 4 years of studying, but in a different way. I think in college I was trying to study just to pass the class because I just needed to know it. Whereas now I need to study because this is going to be my career. This is what I need to know from day to day.
Really important, unlike what you'll find in a lot of your college classes, is that when you get to medical school, things are very self-directed. And it's not going to be spoon-fed to you, and you're not going to be told exactly what you want to know. So you really just got to be self-motivated and put in the work outside the classroom as well as inside the classroom.
I plan on specializing in ophthalmology. At first, I wanted to be an optometrist, which is the everyday eye doctor you see and get your glasses from. But then I worked at a clinic where there were ophthalmologists and they perform surgery. So from day one, I knew I wanted to do that.
I got no idea. When I started out pursuing medicine, I initially pursued cardiology. I said, this is it. I'm going to be like Dr. Burke on Grey's Anatomy. It's going to be me, no problem. Then I worked in an emergency department for a year and wanted to do ED medicine. Then I shadowed a surgeon. Oh man, I'm doing this. Worked with the Da Vinci medical assisted robot, the surgery device. Oh, I'm doing that. I got no idea. And I'm pretty sure it'll be like that until I finally decide sometime 2 years from now.
My middle school was having a shadow day. So pretty much if you shadowed a professional, you got out of school for the day. Of course I would do that. One of my good friends' mom was a dentist, so I shadowed her. And that was probably the transforming day of my life. She was a general practitioning dentist, and just the work that she did and the demeanor that she had and the way the patients interacted with her, it was phenomenal. And I looked up to it, and I wanted to do that. And that inspiration and aspiration hasn't changed.
I wanted to be an architect. I was pretty sure I would doodle houses on my paper all day long in economics 101, etc. And I found out that I hated math, just deep down inside, and I was terrible at art. And architecture is pretty much math and art combined, and so that was out of the picture. I had an accident, a car accident, when I was 17, and had to get the repairs done on my car, and I didn't have a job. So I actually took work as a kennel assistant in a veterinary hospital, cleaning up after dogs. Now, you can imagine what that entails. But the awesome part of that job was that I got a chance to watch surgery. Almost every day, actually, I would get to watch all types of surgeries. And one day, the veterinarian handed me the hemostat and asked me to start pulling maggots out of a cat. I know it's less than desirable, but for me, that was awesome, to hold a surgical tool in my hand and just start pulling out all of these moving creatures out in this living animal, and to have an effect on whether or not it lived or died. So right away I started thinking, well, let's look into medicine. I think I can do this. So in short, yeah, in high school I wanted to be an architect. Now I'm going to be a doctor. Completely different.
Adapting to studying. I never had to study in high school. I did high school in 3 years. I hardly ever studied in undergraduate. Traditionally, depending on the difficulty of the class, I either started studying 4 or 5 days before the test or 2 days before the test, and I just went to class every day and took great notes. But here, I study every day. Yesterday, I studied from 3 to 10:30, and I was not done when I went to sleep.
Being consistent with every week that will be going by, it's always going to be new information that I will have to learn outside of the classroom on new parts of the body when it comes to the cadaver. They'll have to know from, back just by looking at it. So it's just being consistent.
My biggest challenge so far has been staying motivated. People tell you, they give you X amount of material to learn in a short amount of time, and it's true. They give you material after material, and it's not that it's hard, it's just a lot of material. So many people tell you when they get here, it's like, am I really in the right place? But knowing that I'm here and I'm in the right place for such a time as this is what is the hardest thing, just to keep motivating myself, saying this is what I'm supposed to do. There's no other option but MD.
It's just a broad term for working with the older population. And in our case, what we do here at the Geriatric Education Center is we train students, faculty, and health practitioners to provide care to older patients.
As a psychologist, I tend to think about and work with individuals on changing lifestyles and behaviors.
Family medicine is a specialty that entails taking care of all persons. We see everyone. We call it from the cradle to the grave. Deliver babies, and as I mentioned earlier, also take care of nursing home patients. In order to pursue a career in the health professions, in college you have to take at least the prerequisites to get into medical school. I personally was a chemistry and a biology pre-med major, and that worked well for me because obviously the coursework was comparable to that, at least building up to what I was going to be doing in medical school.
As a clinical psychologist, I had to get a PhD in psychology, and after that I had to get training through an internship program. And because I'm interested in research, I also did what's called a postdoctoral research fellowship. And that allowed me to get some additional experience in a hospital setting, providing psychological interventions to medical patients and their families.
I had to get my master's in social work, which I have, and when I was in graduate school, I focused my studies on geriatric social work because that was an interest of mine. And I think that really helped me get this position. It wasn't just my studies, though. It was also some previous work experience that allowed me to get this position. Working for the federal government, working on federal grants for other agencies. I think all of those combined with my education really helped.
I speak to high school and college students about careers in medicine or dentistry all the time, and I want to point out to them is, they think it's all about the money. A lot of people think, and it's somewhat of a misconception. They think doctors and dentists are rich. If you really want to make the Trump dollars, that's going to be in the high power financial game in which you learn how to flip big money. But again, the sacrifice and the commitment to career medicine was paramount in that, you're going to incur nowadays probably $250,000 in debt. And the reason that's important to point out is there are no guarantees. There are no guarantees in your first year when you take out that $65,000 that you're going to get through. And even if you did get through medical school, there's no guarantee that you're going to get a job. So it's definitely a sacrifice and somewhat of a risk. But at the same time, having been in this profession and being on the teaching side, those that are committed with good guidance tend to do just fine if they don't let that obstacle deter them from their mission.
My mom was a geriatric nurse for a number of years, and so I was exposed to it at an early age, and I was always interested in the stories that she would tell when she came home and talked about her patients.
If it really is something that you truly want in your heart, don't let anything deter you from it.
Do what you have to do now so you can do what you want to do later.
If you could go to undergrad for free, do it. If you can apply to scholarships, try to minimize your costs at all costs.
Don't wait until you're in medical school to start learning how to become a doctor. Make sure you use all the resources that you have.
That's number one. You can do this. And seriously, it doesn't matter what anybody tells you. You can do this.
If that's what you really want to do it. Don't let anybody tell you, oh, the MCAT is hard or the hardest part is getting it. No. If you know that's what you want to do it.